get along with the voices inside of my head. You're trying to save me, stop holding your breath. And you think I'm crazy, yeah, you think I'm crazy, crazy.
Dr. Vasquez, tell us a little bit about the history of agoraphobia.
Well, little is known about the origins and discovery of agoraphobia. In the 1960s, though, it was discovered that phobias basically divide themselves into three rather different kinds or categories: agoraphobia, social phobia, and specific phobias. That set the stage for phobia classifications that is in use today. Agoraphobias, or phobias, is described as a fear of being in a public place or open areas. It derives from the Greek word agora, meaning outdoor marketplace, or phobia, which is the fear of. In its severest form, agoraphobia is characterized by paralyzing terror of being in places or situations from which the patient feels there is neither escape nor accessible help in case of an attack. People with agoraphobia confine themselves to places in which they feel safe, such as being at home. The patient with agoraphobia often makes complicated plans in order to avoid confronting feared situations and places.
Dr. Tobin, tell us a little bit about your profile with agoraphobia.
Indeed you ask. Approximately 3.2 million Americans, adult ages from 18 to 54, have agoraphobia, which is precisely 1 in 84 people in the United States, or calculations show 1.18% of the population.
Wow, that's specific.
Yes, sir. Well, agoraphobia occurs about twice as commonly as among women as it does men. Studies have shown that it happens in around 2 different age groups, from early to mid-20s to late 30s. Agoraphobia accounts for approximately 60% of all phobias there are. Dr. Mather.
Yeah.
What would you say the causes of agoraphobia are?
Causes of agoraphobia?
Yes.
Yeah, many causes. I see. Yeah. Yeah, no, we gotta tee off at 4. Yeah, 4 some gun. Yeah, Tiger Woods. Oh, shoot. Yeah, no, agoraphobia. Many causes. Some are... Oh, shoot. Some are chronic users of tranquilizers and sleeping pills, such as benzodiazepine. Yeah, I don't really know what that is. Agoraphobia can be caused by an attachment, a deficit, or the temporary loss of the ability to tolerate spatial separations from a secure base. Meaning that one becomes so attached to a secure feeling, he or she panics when they are away from that secure feeling. It can also be caused by the avoidance response due to the fear of the situation in which the panic attacks occurred. Sorry. Caffeine, certain illicit drugs, and some over-the-counter cold medications can increase panic symptoms and increase agoraphobia. Dr. Nelson, tell us a little bit about the diagnosis.
Well, most people who present to mental health specialists develop agoraphobia after the onset of panic disorder. Agoraphobia is best understood as a behavioral outcome of repeated panic attacks and recurring anxiety that leads to an avoidance of situation where a panic attack could occur. In rare cases where agoraphobics do not meet the criteria used to diagnose panic disorder, the formal diagnosis of agoraphobia without history of panic disorder is used.
Dr. Tobin, what are the symptoms of agoraphobia?
The symptoms of an episode of agoraphobia might include the following:
I think I'm gonna throw up. I think I'm...
In most cases, the person with agoraphobia feels some relief from the symptoms after he or she has left the situation or returned home.
Dr. Nelson, tell us a little bit about the treatments for agoraphobia.
Treatment of agoraphobia usually consists of medication plus cognitive-based behavioral therapy. The physician may also recommend an alternative form of treatment for the anxiety symptoms associated with agoraphobia, such as reduction of caffeine, which contributes to panic symptoms.
Agoraphobia can be cured. With proper treatment, 90% of patients diagnosed with agoraphobia can recover and resume a normal life. The other 10% can resume a life with less severe symptoms.
Dr. Tobin, what are some of the impacts agoraphobia has on society?
Well, there are many famous people with agoraphobia, which include Billy Bob Thornton, Woody Allen, Paula Deen, Kim Basinger, all with minor cases or cured cases of the mental disorder. Some even say Sigmund Freud had agoraphobia. Some famous movies that have agoraphobia cases are Ocean's 12, The Benchwarmers, The Citadel, Frozen with Fear, all with certain characters that have different levels of agoraphobia. There's also a book, I Wish I Could Be There, by Alan Shawn, where he is a real-life agoraphobic and tells about his life in his writings.
Get along.